interviews, every boss must be here. True vision, stand up tall, breaking chains, re-breaking walls. Stand for justice, stand for peace, telling stories never cease. Education, health and change, building dreams that never fail. With one vision, one nation, one dream, let's move forward, let's be seen. And here, let's unite. Because we rise, we shine, we keep it real. Breaking good news, you can't refuse. Stream vision, light the way, bringing truth to every day. Stream vision, light the way, bringing truth to every day. Stream vision, light the way, bringing truth to every day. Stream vision, light the way, bringing truth to every day.
Let me say good evening, good afternoon, good morning, wherever you are following us from this evening. My name is Titus V, Ballah, and I want to welcome you to our Screen Vision Days, our regular Sunday show. And for today's show, is going to be, a very important show tonight. So, I ask you to share the show. It's not only going to be, informative, but also going to be educative. It's a life-saving show tonight. So, we ask you to share the show, on your social media platform, share with your colleagues, your brother, your sister to follow the show. And every group you are part of. So I want you to share the show tonight because tonight conversation is going to be kind of a different. We're going to be live on some radio station back home in Liberia. It's also going to be from Zozo. We're going to be live in Zozo, Lofa County. Also going to have a radio station from Bon County. So we want you to join the conversation tonight because this identical conversation, we now just wanted to come on the platform to discuss it among ourselves because the old man there from Togo Eastern, from Zogowi, Zotapa, she have to get the information. It's about health. So we ask you to share our show, encourage your colleagues to follow so that we can have a very good conversation tonight. We have a team of panelists. Let me try to bring my colleagues on. The man Sylvester Blessing, JJ is at the back. Broske Gwambei is also there, and I also have some guest panelists from some institutions. They are Liberians. They are here to study in Rwanda. So keep glued to your radio. Let me not say radio, to your phone. And for information, we are also live on YouTube. So if you're using your computer, you can go on YouTube to follow the show. If you are also on your phone, you can use YouTube as well, and then that Facebook. So, like I said, we will also be relayed. This identical program going to be live on Vera radio station in Liberia, like 4 radio stations in Liberia, so that this information can go across because it's actually for the people. And having said that, I want you to share the show tonight before we try to bring our people on. We have students who are serving who are going to serve as guest panelists tonight for the important discussion because it's about health. I am from the environmental field, I'm not from the health area, so that's why we bring these students as guest panelists so that they can come on the platform, to help in the process. Because we have a very important guest who is from Rwanda here. He's sort of coming on the show to discuss the issue about the monkeypox back home. He has been working in Rwanda here. He's also teaching to Vera University here, and he have experience in so many cases. Like you talk about viruses, like you talk about Ebola, you talk about the COVID-19, you talk about lots of few. So let me not talk much about him. He's going to come to tell his own story. But tonight, it's kind of important for you guys to share the show so that this identical information can go across to Liberia, our people following back home. Or let me bring my colleagues on so that we can, So we are waiting for the guys, from Liberia to join. So please just share the show tonight. It's about life saving. The issue about monkeypox in Liberia is kind of a serious, not serious to that extent, but we have to start working to tackle that identical issue before it goes off hands. We all know our health system in Liberia, how it's looking like. The people are still fighting to build up the system. They are doing everything possible, to get everything straight, but we still have some challenges when it comes to, the health facility in Liberia. So looking at that, we have to try to protect ourselves, to prevent ourselves from all, sorts of virus or illnesses, so that tomorrow we can now be called, late so and so year, God forbid, it won't happen. And that's why this kind of information or discussion is kind of important. And today, we want you to share our show, let's have a fruitful discussion. Let me greet my colleagues. Sylvester, good evening. And Brooks, how you guys doing?
Yes, Comrade Tata, it's a pleasure once again being here. I just want to appreciate you and Comrade Sylvester. Good afternoon and good evening. I know you are right here in Rwanda, so let me just say good evening. So good evening to every one of you, and it's a
Good evening,
pleasure
my
to be
brother. Good
here,
evening.
learn from uh, our experts that are coming on board to educate us on the health issues that are unfolding in our country, Liberia.
Yeah, sure. It's important, and that's why we're encouraging everyone to share our show. Encourage your brothers and sisters to share the show tonight. I'm trying to do same. And before we can bring our guests on, we want at least to have maybe a 50% watching, and then we can start a discussion. So please share the show tonight. If you are following from Liberia, if you are following from the US, in Rwanda, whatever part of the world you are following us from this evening, we want to say thank you so much for joining us. Let's share our show. Let the information go across so that people can understand the issue that's going on back home in Liberia and how, what are some of the measures that we can take to prevent ourselves, from contacting, the virus. So that's why we are here tonight, to discuss. As you may be aware, we have a two programs running on the platform. The regular Sunday show, and we have environmental talk on Wednesday, and every Sunday we discuss global issues. So today we have a very important issue to discuss, and it's important that you share the show so that other people can follow and have their say. Because we also pin the number you're going to call and then have your saying as well. So let's share the show, gentlemen, and let get more people following. We have let me be entertaining you guys with our own song, Screen Vision. We have our song. Yeah, so like let's try to play. Yeah, let me Victor Mame. Victor Mame is here. So like we said to tonight we're going to be joined by other guest panelists. We have our guests. We have two persons, and we also have a guest panelist. Bring them on the show tonight to discuss the issue. So, like we said, these panelists that we are bringing on, these guest panelists, the students that are studying. I'm getting a feedback from somebody. Can you mute yourself? Uh, these guest panelists, they are studying. Some of them are doing a biomedical laboratory science, and I think the other one is also doing a nursing. So it tells you that tonight the house is kind of a filled with a reservoir of knowledge. And with our own panelists on Screen Vision, the man Sylvester Blessing, JJ, Broske Gwambei, and my own co-host Victor Mami, we are going to dive into the discussion tonight, ask various questions, and then we hope to have a answer to those questions, and we all can come to a conclusion or a way to handle the situation that is going on, back home in Liberia. So JJ, what's your take on this show tonight concerning our topic? Let me try to bring our guest panelists on as well.
Yes, thank you very much, Mr. Ballah, and good evening again to everyone. So, I think this show is just an reaffirmation of what Screen Vision is about. In as much as we are media institution and we in our own capacity trying to contribute to society, is important enough that we have this conversation to at least to enhance the awareness in our country concerning this mpox outbreak. So my expectation tonight is given the fact that we have invited a person who is knowledgeable about this. As a matter of fact, because it once occurred in Rwanda, and they were very swift to have combated the virus. So I'm hoping that our guests may come with more points, and so we can rely on that to carry on awareness to assist our health workers.
Yeah, and
Thank
that's
you
it.
very
That
much.
it's very important because looking at the what happened in Rwanda and giving his own idea, the expertise when it comes to how they handle those cases in Rwanda, I think our people back home can also learn, from such ideas to carry on what they already have, at least to add on what they are already working on. So it's kind of important. And I want to say thanks for joining us as well. Let me bring our guest panelist, Ami. Let me try to bring Ami. Wow. Ami, your background, anyway, is good. Ami, good evening.
Good evening. Hi.
Okay, thanks for joining us. What's going on from your community?
Yeah, all good. Let's start.
Okay, it's good to hear.
Thank you.
So we are trying to get okay. Our the guy from the radio station back home. He just joined. Going to bring him on the screen, and we can like dive into the discussion quickly because we don't really have much time on the radio in Liberia. They are only giving you like 1 hour, so we have to manage the time. Yeah. So James, if you are getting it, you can just show yourself. Let's see you. The camera. Kind of turn your camera on so that we can see you. And then okay, James is trying to set up everything there. Yeah, so James is trying to set up the stock. Like we said, we want the conversation to go to the layman back home, and that's how we made this arrangement to for this radio station, and they gave us they go ahead. They say, look, we're going to give you guys the opportunity to stream, to air your show. It's free. You're not going to pay, but we're just going to give you guys 1 hour. Just imagine that. Do you know how much how much you're going to pay on the radio if you are using radio just for 1 hour? It's kind of a costly. So it's actually important that we appreciate it. So Jim went back. We hope that we're going to have a very good network in Liberia so that we can support the show. Victor, how you doing? What's going on from Yanza?
My dear brother, I'm doing pretty fine, and Yansa is very cool. We thank God for everything. We are doing fine here.
Okay, that's good.
Yeah.
That's good. So, Mama, you can take it. Let me try to pull something in place shortly, and I'll be right back.
Yeah. Chief bro.
Yes, Victor.
Mr. Gombe.
I'm here, Chief. How is everything?
Yeah, everything okay from my end. How that's sir? How you in?
Yes, here is good. I mean, how are you? Are you okay?
You are muted.
Okay. You are muted. We are not hearing you.
You need to.
Yeah, I'm fine. How are you?
Okay, that's
Sorry.
beautiful. It's a pleasure actually being here for us to discuss this important issue. Yeah,
Sure. Thank you so much.
yeah. Victor, you can go ahead.
Yeah. So Sylvester, you're in too.
Come in.
Are you getting me? Oh, okay.
Yeah, so as I was saying, my end is cool and everything is running out smoothly. Alhamdulillah.
Okay. Yeah, so it is a pleasure to be here once again to discuss issues relating to our country. The outbreaks of the Mpox is very, very serious. It is good that we gather here again to inform our people. The problem about our people, the denial. Some people will be saying, "Oh, I cannot go for vaccination," or the virus. People don't want to believe the fact that the virus is real. So, such discussion is very important as a create awareness for our people. So it is important that we all gather here again to discuss some of the issues affecting our people and what can they do. So we are hoping to dive into discussions that will enlighten the minds of our people on those various preventive measures that can be taken to avoid the spread of the virus. So, I think Brooks did.
Okay, I'm back. So if you are watching, we're going to be live on Super Bongi Radio in Banga, Bon County. We're also going to be live on Kwatekeh radio station also in Banga, Bon County, and we have the alternative for youth radio in Zozo, Lofa County. Okay, our guy from the premium FM is also on. Let me try to bring him. Okay, still trying to set up the stuck. So, gentlemen, tonight the show gonna be kind of a like people can say fascinating. Very important discussion tonight. So we're trying to get everything set up before we can dive into the conversation tonight. We hope that the network going to James, if you are ready, just try to signal us, and then we can start the conversation. We are waiting on you because we want to get everything in tight. We are not getting you, James. So tonight we are going to be live on Super Bongi radio station in Bon County. We also have a Kwatekeh radio station in Bon County, and we have a alternative youth radio station in Zozo, Lofa County. We also have the Premium FM in Bon County, Banga. So tonight we're going to be live on this very radio station so that the old man all the way there in the village can get the information because we want the information to go across. And that's why we bring these panelists, people who are well schooled in this area. Like why ourselves, we've been reading about these things, so we're also knowledgeable when it comes to the subject matter. And to that, we're going to work together to bring you a very important discussion tonight that you can take home. You can use that information as guide to protect your very self, and your family from coming in contact with the virus. So please share our show. We are just trying to we are waiting on the guy from the radio station back home in Liberia so that we can start a discussion tonight. And let call your people back home so that they can listen to this radio station, like, you know, to share the information around. It's kind of important. It's good that at this early stage we start to give out this awareness, give out this information, you know, so that people can start working on, you know, prevention. Yeah, because there's a saying that says prevention is better than cure. So we don't want people to have the virus all around here. You know what happened in Ebola, you know what happened in COVID-19. We lost our families, our family members, our loved ones. Today, there are other people who are, I mean, they are motherless, fatherless, they don't have a family, because I know somebody who, I mean, the entire, you know, family died in the house. They were the only, you know, person that was saved in the process. So we don't want for similar thing to happen back home. Like I said, our health system, we still trying to build up. The government is working out, you know, doing everything possible to have a very good system back home. You know, in the wake of that, we also have to do things that will protect ourselves, our family, our community. Because if you get the monkeypox, for example, in Banga, or you get it from Zozo, you're going to move around. And these people that you're going to come in contact with, they're also going to move around. Like, you listen to Jabate, I'll try to search for this video. I think if some of you guys, Jabate video, you can please share with me so that I can start, I can you know, share on the screen so that other people who are watching can see tonight what is going on. This guy came on. He was like, I'm not sure about it. I have the virus. So look, it happened like this. He tried to explain what actually happened to him. And you don't really find much people doing that. There are other people who would be like, I cannot go on the radio. I cannot go on, you know, on any platform to discuss this thing, the viral, this, you know, stuff like that. But this guy said, no, I have to come on, you know, to discuss the issue. James, what's going on? I pray I will have a very good internet from Liberia. So like I was saying, the guy was like, look, Jeremy, I have to come on to discuss the issue. So he started to explain what happened when he went to Lofa. It was like, what happened, you know, explain what happened when he went to Lofa and other thing. Fedja, you are on, you try calling me, what's going on?
Yeah. So, like my internet was giving late. So I was just like sending you a message so you can add me to the stage.
Okay, that's good. We lost this guy again. I don't want to start the ball rolling before we be live on the radio. That's why I see I keep delaying, you know, all that stuff like that. So what we can do, I think we can start the conversation now. Let's start to introduce ourselves, you know, and then if we go live, maybe we can come back when we are talking. We're going to see a signal that yes, we are on the radio station. Let me try to check on him again. Who are going to church today? I saw some people saying, yeah, we have to pray.
Some people attend stay home after.
Are you saying?
I'm a senior pastor, but still Baptist.
We're not John.
Some people attend stay home after.
I have a lot of members today. Still Baptist International. The church was packed.
Yeah, I think you'll be the bishop for that church.
Yeah, that's good. Okay, so I think we can start our conversation while we are with the guy from the studio there.
Still,
okay. Let's start the conversation tonight. And if folks, if you are watching this screen vision, we're about to dive into our conversation tonight. Tonight we are discussing health issue, right? Our topic tonight is monkeypox is now a public health emergency, of international concern. So you have to know the cases, know the symptom, the preventive measures, and know the treatment as an individual that you need to take, all the measures that you need to, consider as you move around in your community, in your school, other stuff like that, at your workplace, so that you cannot get the virus and then take it back to your community or to your house. So, gentlemen, we want to say welcome to Screen Vision. Like we always do here. JJ, can they introduce yourself? We have the 7 person watching right now. Can you introduce yourself? Let's start the ball rolling. Sylvester, are you getting me? Yeah.
Okay. So, yes, I'm hearing you now. I was trying to unmute. Good evening to our people in Radio Land. My name is Sylvester Blessing JJ, one of the panelists for this show tonight, and a member of Scrim Vision team. So again, as you may be aware that this platform is about providing information to improve society, and given that we have a guest tonight, I'm glad to be on this platform to discuss Mpox related issues in Liberia. Thank you very much, Mr. Ballah.
Thank you. And then let's go to Victor Mamay, my own co-host. Victor, welcome.
Yeah, thank you, CEO, and many thanks to all of our wonderful listeners. It is a pleasure to always sit on this platform to discuss issues of national concern. So I'm Victor Mamay, the co-host for this discussions tonight. It is a pleasure again to be here. Thank you.
Indeed, it's a pleasure always having you on, Victor Mamay. Let's go to the man, Broski Gwambei, the host for the environmental talk. Bros.
Good evening, good afternoon, and good morning, wheresoever you are following us from. My name is Brooks K. Gwambe. I reside in Rwanda, Kigali City. It's a pleasure being here to interact with our distinguished colleagues and guests, as well as the guest panelists. So we hope to have a very fruitful discussion tonight to learn about the diseases in our country, Liberia. Thank you.
Thank you, Bros Gwambei. And let's go to one of the female in the house. That's Ami. Ami, welcome to Screen Vision. Can you introduce
Thank you very,
yourself? Yeah, go ahead.
thank you very much. Good evening, everyone. My name is Buka Amiwa. I'm currently studying nursing in Rwanda, and it's a pleasure to start this program.
Sorry, this is my fish.
It's a pleasure tonight to be part of this great program. Uh, and I wish to all our listeners out there, you take it as a great information
So,
for health. Thank you.
Ami, what are you studying in Rwanda here? What are you studying? And which university? Sorry.
Okay, I'm reading general nursing and at the University of the Adventist University of Central Africa, Auka.
Yeah, it's important to flag that out so that the public can know who is on the platform tonight. So Annie is reading general nursing, so it tells you that we have somebody who from the background of health. And I will have a patient Conan. Patient, let's hear you. Patient, you getting me? Can you unmute yourself? We are not getting you, patient. Can you unmute yourself, please? Unmute yourself, patient. We are not getting. Yeah,
Okay, thank you. You getting me now?
you are good to go.
You getting me?
Yes, yes,
Okay,
yes.
thank you, Mr. CEO. My name is Patience Kona. Okay. Patience Kona is my name. Studying at University of Rangiri, INES.
Okay.
I'm doing biomedical laboratory science. Year 4 students in Rwanda.
Okay, that's good. Thank you,
Thank
patient.
you.
And let's go to the man. Who's this guy? We drop off. Frederick. Why is Frederick? Frederick. We lost Frederick. Okay, Frederick. So, gentlemen, I think you heard it from our guest panelists, and also our own panelists here on Screen Vision. This is what we do here every Sunday and Wednesday. We usually come on the platform to discuss issue of national concern. And today is very important that we come on the platform to discuss the current health situation in Liberia as it relates to the monkeypox virus in Liberia. And like we said, we're trying to come on to get connected with the radio station back home so that this identical conversation can be spread out there to our people, because we don't want it to just be on social media. The old man there in Zotapa, like I always mention Zotapa because our there Zogowi, the old man there in Campley, the old man there all the way in this place in Zoza. He or she, Omar doesn't have a big phone, like Android phone. I mean, the papi sitting on there, he doesn't have Android phone. So he listens to some of the conversation by the way of radio. So that's why we decided to contact this radio station. And they were like, yes, we're going to give you guys a platform. You're not going to pay a cent, which of course we appreciate that a lot. And that's why we are trying to do everything that this identical show tonight be relayed on this radio station back home so that the information can go across. And this is our own way here on this platform, Screen Vision, to also contribute back to the society. Because that's what the media is here for, to carry on awareness, to carry out this information to the public, so that the public can be aware of every national issue that is happening or global issue, so that there are other people who they don't really do research that you and myself. Probably, I mean, they might be doing research, but not in certain area. Yes, so if you come on this platform to discuss some issue like this, you inform the public, and it's going to use those information, and it's going to help them in the community, in the workplace. I mean, every place you see themselves, it's going to help them. So that's why we are here tonight. The monkeypox issue in Liberia is kind of serious. I'm trying to download this guy video Jabate, but let me put up this statistic from Enfield. Enfield put up this identical information. The National Public Institute of Liberia, Enfield, monkeypox outbreak in Liberia. So this information, Liberia monkeypox cases updates from January 1st, 2024 to May 22nd, 2025. This is the current, information that's out there on Enfield website. So they say total suspected cases, we have 700 now, and received by lab. We have 700 total suspected cases. Out of these 700 total suspected cases, we have 618 that the lab received from Liberia. Many of these people went to the hospital, they went to the lab, and they were tested. Now, and the 618 were tested because after the lab received them, they also tested these people to make sure, yes, whether this identical monkeypox is there, how far, what are the level when it comes to the how do I call it? Because if you just come in contact with the monkeypox newly, the rate and when it's going to spend like 1 month or 2 months in your system, the way in which you're going to react, it won't going to be like the 1 month or the 2 weeks on. So they're going to check you, and then they said the total cases that were tested, we have 61, and then the total lab confirmed. So after they've gone through all these things, and then they have 112 lab that were confirmed. The total lab confirmed was 112. And now the active cases that we have is 35 active cases, and then the recovery cases that we have, they are 77. So far we have like a 0 death. So now that's why it's important for us to come up, to give out this awareness so that people can be informed. Because as for now, we have 0 death, and as for now, we have like 35 active cases, meaning these people, they are being admitted at various hospitals and they are going through treatment. Yes. And we have 77, that were, recovery cases. So it tells us that we are actually, it's not a kind of a severe for now in Liberia, but it is good that the public be informed about these things that is happening now, so that everyone can try to take these measures. Everyone can try to take these various measures, in Liberia. So let us go to the panelists now. Now let's start with the man, JJ. Not JJ, but JJ lost. Yeah, we lost JJ. So let's go to Victor, my own co-host. Victor, you are Liberians, and now we are discussing such an issue that is unfolding in health issue in Liberia. What does the conversation means to you as an individual?
Yeah, thank you, CEO, and many thanks to all of our panelists. The problem of virus outbreak is very, very key. But we need to create the awareness so that our people can know the danger and how to prevent it. We all witnessed what happened during the Ebola time, coming up to the coronavirus. From the onset of those outbreak, people were like denying the fact that there exists a virus called Ebola. So it is the same. I want to believe it is the same thing that is going on among our people. Some are not still believing. Some still don't want to believe the fact that there exists a virus called Mpox.
Yeah.
So
So in a summary,
gallery,
we have to be
yeah,
swift. Yeah.
yeah, gallery here tonight, to discuss about the issues of Mpox becoming a national and international concern is very, very important. It will highlight how serious it is, and then propose some preventive measures, educate our people, how to protect themselves and their family. So this gallery is very, very important.
Thank you.
We
Thank
hope
you,
to
Mamay.
move from our panelists. Thank you.
Thank you. Thank you. Broskill Granberry, let's hear your intro.
Okay, thank you very much for the opportunity.
So while we are sorry, bro. So while we are doing this, let me try to bring our guest on. He's in the back, Patrick. Patrick is in the back. Let me try to bring him on. Yeah, okay. I think we have our guest now. Our guest is here. Yeah, so Patrick, how you doing?
I'm good. How are you doing? Good evening, everyone here.
Okay, good evening. Okay, so folks, before we continue this thing, okay, let's Patrick kind of wait small, so bros continue.
Okay, like I was saying, thank you again. This is our commitment on stream vision to discuss issue as such. We don't have any limitation when it comes to discussion like this. So especially the monkeypox virus in our country, it is important that we communicate the information, although we are not from, some of us not from the health background, but it's necessary that the communication be circulated by everyone. So gathering here tonight to discuss it, and then those in the field of nursing and medical practitioners to come and educate us and educate the public about this. I mean, it's very important, and we hope to hear more from them. That we will take the message out, and people will follow for the message to go out. Thank you very much, and we hope to get more from them.
Thank you. And who do we have there? Ami, let's hear you. The intro.
Okay, so thank you very much once again. So this information is a very serious information, of course. So we as an incoming healthcare workers, to share this information out there to people who are not educated or who don't know about the effect of the disease or virus. So I pray everyone who is listening should please take it into consideration because it is very serious and it has now become a public health concern. Thank you.
Thank you. Let's hear you, Frederick, quickly. Frederick. Okay. Patient, let's hear you. Patient Conan. Okay. So I think they are facing a network issue. Let me bring JJ back. Sylvester, welcome back. And let me welcome our guests. We have the man Patrick. Patrick, welcome to Screen Vision.
Thank you so much. Like I said, I would like to welcome each and everyone to discuss this matter that is a national concern or international concern. So Mpox is a very serious disease and it is a very dangerous for each and every single human being. Thank you so much for this opportunity.
So, no, sir, who is Patrick? Let's get a little information about you. Who is Patrick? Yeah.
Very good question. Patrick is a simple guy who lives in Rwanda working as a biomedical laboratory scientist in a hospital located in western province of Rwanda. And also I work as a head of molecular biology, specifically testing these viral diseases such as Mpox, COVID-19, Ebola. I think you remember a certain virus that took place in Rwanda, especially from DRC Congo, which is called the Rift Valley. This is another virus that used to attack these domestic animals that we usually consume as human beings. I also have experience in terms of Ebola, like I said, also uh, testing these PCR DNA testing, like that, parental DNA. Yeah, simple as that.
Okay, thank you, Patrick. And then, folks, if you are watching, I think you listen to Patrick, kind of giving his own story about who he is. So it tells you that our guest is not just an ordinary person; he's someone who is knowledgeable when it comes to the topic tonight. So ask you to relax, and then if you have a bottle of water, you just take it and start to drink, enjoy yourself, and you're gonna enjoy the conversation tonight. Let's go to JJ. JJ, kind of your intro. How do you feel? What's your take about this topic tonight?
Yeah, so thank you very much, Mr. Bada. Like I said earlier, it's important that we have this kind of conversation, so at least we contribute to the awareness of mpox prevention. So my expectation tonight is good enough that we have Mr. Mugabo, who has been in the trench of fighting this virus, given by what they have done um, during its outbreak in Rwanda. So my expectation is that we gain some information from health practitioners or students in the field of medicine, our guests, and then how we can amplify the voices towards the prevention of mpox. Thank you very much.
Okay, of course, how we can amplify the issue about mpox in Liberia and other parts of the world, so that you guys can be informed about the current health issue that is affecting lives in Liberia and other neighboring country. So today we are blessed to have Patrick. Let's go to Seton Trygo. Trygo, can you introduce yourself to us? Trygo is one of our guests on the show tonight. Though his camera, his lighting is not that kind of okay, but we can manage. Right, Trygo.
Okay, thank you, sir. I'm Trygo Seton by name and a biomedical laboratory scientist in practice at INES-Ruhengeri level 4. I want to appreciate Screen Fiction for this program and also everyone taking part in this program. I want to appreciate all of you for coming. Thank you.
Yeah, sure. It is important to appreciate everyone because everybody have their own busy schedule, and to see people coming here to discuss the issue, it's worth appreciation. So we must say thank you for coming as well, Seton. But quickly, let us start our discussion tonight. We are still trying to get in connection with the guy from back home, but we cannot continue to sit. We are going like 48 minutes in our time. So I think we can start a conversation with our guests. And I want us to start the conversation like this, Patrick. Now, what exactly is this monkeypox, and how does this monkeypox differ from other viruses or diseases like the Ebola, like the COVID-19? Let's start the place.
Thank you. This is a good question, which is very hard to understand, but easier to make it simple to each and everyone. This mpox or monkeypox, it is generally zoonotic disease, which means if we talk about zoo, we understand something relating to animals, forest, and it is not bad to think that someone was related to these forest animals. That's how this monkeypox came out in our Africa, in our country, globally. So far, Mpox, it is a zoonotic disease and viral, which are caused by these animal that are not mostly supposed to be eaten. You understand? So if this disease came out, which means someone among of the people used it in terms of meal. That's how this viral came out into our entire life, and we live with it. That's how it came. That is a simple definition I can give out to each and everyone. So if something that is not supposed to be eaten by a human being, and we find out that this disease, which is supposed to be in those animals, most especially in the forest, how comes to be in a human being? There are some crucial questions. Someone is just consuming those animals from the forest. By the way, from the beginning, this monkeypox was discovered in 1917, which means we are younger to eat. We are very younger to eat. We are very, very younger to eat than according to the age. But in 1958, it was discovered in a laboratory in DRC Congo. And mostly, especially this country, DRC Congo, it is the one that harbors a lot of viruses that are being discovered that are coming from this virus, such as Ebola, COVID-19, Monkeypox, and Rift Valley. Those are the viruses that are being found in DRC Congo, our neighboring country. So which means how comes to see someone is suffering from Mpox, Monkeypox, it means the person has been eating those animals. You understand? Which is not supposed to be eaten. That's how it came.
Okay.
So
Okay. Go ahead. You still want to ask something? Go ahead.
So it came like that, and according to the status of people, human living, that's how it is. It keeps developing to each person, to one person to another. Like it is most especially affecting those sexual workers. You understand? That sexual workers had a sex with someone who had been eaten that, or slept with another one who had been affected with this mpox. Drivers, like we have those people who are driving from one country to another country. So remember, this person, if he drives from Rwanda to Kenya with a wife, remember his wife is remaining here in Rwanda, so he's going to meet another person there who carrying out prostitution in that country where he's going to.
Mhm.
You understand? And that person who is carrying out prostitution in Kenya harboring Mpox.
So Patrick, we will get to that. I want to know how does this MPOP differ, because we have COVID-19 and we also have the Ebola and other thing. Looking at the MPOP and looking at what's the difference? Yeah, between these.
The difference there is no big deal. There is no much difference between, because COVID-19, it is an airborne disease mostly, and this
Mhm.
one also, it is we can classify it into STDs. You understand? Contact person to person. Yeah.
Okay. Okay, contact person to person. So, folks, if you are watching, this is Screen Vision, and we are in conversation with Patrick. Patrick's Rwandese, who has been working in the health sector for so many years now. Have various experiences when it comes to these diseases, the Ebola, the COVID-19, and the Monkeypox we are discussing. So we are in conversation with him. Like we said, our team, the radio station back home, trying to do a connection. I think you can see on the screen, it's trying to load. It's like because of the network issue there. So that's why we are facing this thing. And now let come to this one, Patrick. What do you think this monkeypox now is become an international concern or global concern?
The reason being that it is not only Rwanda, it is not only DRC, it is not only Liberia, it is moving viral. That's why we call upon international community to take care, to take responsibilities that is against to this monkeypox, because it is affecting a lot of people, most especially young generation, our age, because of shyness. Whenever someone sees some changes on the skin, he feel fearness of going to the hospital in early time. So we need to call the international community to come and take some responsibility, some guidelines, how this should be eradicated, because it can be over, of course. Yeah.
Okay. You have been working in the health sector in Rwanda. Now, let us look at the case, how this whole monkeypox thing started in Rwanda and how you guys, tackle these things. Because we're trying to get your own experience from Rwanda so that our
Uh,
people back home can also build on your experience, like the one they already have, and they can add on your experience to be able to solve this problem in Liberia to carry
so
on.
far, thank you for the good question. Uh, we had the first case in July last year. July
Okay.
last year. But when we were trying to trace exactly where this person get it from, we found out there was moving to DRC Congo.
Okay.
And that's why I was saying that Ebola, whatever I mentioned, they are coming from DRC Congo. But I'm not just judging DRC Congo that are the one that are harboring these viral diseases. But if we trace, whenever someone traces where the case exactly coming from, we find out that a person has been having an experience in DRC, like trying to chase life. That's how we find out that first case we found in Rwanda was a person who used to travel in DRC Congo.
Okay. So
Yeah.
so that means it didn't take a long time in Rwanda. You guys were able to just control it right away.
Pardon?
I'm saying that means the case doesn't really, take longer time in Rwanda. You guys were able to, solve the problem right away. That's why
Yeah,
it is.
we are trying to stabilize the health of those people who have been affected with it. But so far so good compared to the previous cases. So now I can just measure two cases that we have today currently. Yeah.
Ah, okay.
So far so good.
Yeah, that's good. So I think I have other panelists on. We as we dive deep into the discussion, they're going to come up with real questions. We have our guest panelists on. I think you listen to them. And Seton Trygo here is also a guest. So Seton, let's hear you on this one, then we can come back to Patrick. Seton, are you listening to us?
Yes, sir. Thank you for calling me in. Like our guest, our guest spoke on monkeypox very well. And then he mentioned few things. We wouldn't understand. We wouldn't like maybe think our people back in Liberia there will understand like the way he's somehow pushing it, but we are here. We understand it. But then one thing he talked about was this monkeypox is an animal disease, and then it has been spread out to people based on other people that like to eat some animals like domestic animals like rodents, not the domestic animal at all, like rodents and other things, monkey, rats. Like back in Liberia, there we have something called opassion. Everyone likes to eat opassion. So if you have someone they are fine taking opassion to eat it, and then that opassion have that disease of in them, that person gets infected immediately. So that's one thing to talk about. And then the way in which this sickness is transferred through fluids like sweats, through STDs, some sexual or transmitted disease, sweat and other things. So people out there will not understand like some things he's saying. So we are only here to put it in a tone for our people out there on the radio stations to understand. Thank you.
Okay, thank you. Now let me come back to Patrick.
Yes,
Patrick,
Mr. Ballah, before you come
yeah,
to Patrick, I don't know. May I?
yeah. Why you want to say something?
Okay. Okay. Yeah. So before you come to Patrick, I just wanted to build on the last question that you asked Patrick in terms of the contact tracing. So my point is, I'm kind of wondering, is it that in the month of July last year when RBC and Ministry of Health Rwanda tried to combat this virus, is it because do you think Bullet Patrol is also was the first step that we have been taking in our country, Liberia, to regulate the spread of this virus?
Pardon your question?
I'm saying, do you think Bullet Patrol, a strong Bullet Patrol, could be the first step in my country to combat this virus? Because we are discussing the spread of the virus with regards to another person, or with regards to travelers. That is, another person is taking it from maybe Sierra Leone, Freetown to Monrovia, Liberia. So my concern is, do you think Bullet Patrol can be the first step towards combating this virus, especially with regards to spreading it?
What do you mean by pro patrol?
So let me just make something clear. So because you said when you guys had a fire case in Rwanda in I think June or July, and you started to trace where this person came from, and then you noticed that the person came from DRC Congo, right? So now he's asking, do you think in order for us to reduce the spread of this adenovirus, can we regulate the inflow and outflow of people between countries, how people come in? Should we have something like is it going to help us to reduce the spread of the virus by telling people, look, before the person come in the country, maybe we can get a team that will be checking people to various border spread, making sure that they are free before coming in the country.
Yeah, my take is just simply because when someone is being affected with this mpox within 1 2 days, sometimes because of our immunity is totally different from mine, is totally different from yours. I may be having a sign and symptoms within 2 days, but someone may take a longer of 1 month. So which means sometimes to take a control in terms of bordering, to check each and every person who are crossing the border will be difficult. But uh, we would not put some burdens to the people who are crossing the border, but we can also entertain, advertise, keep sharing the knowledge about this mpox concerning to how the symptoms and signs are, so that whoever sees any single sign should be go to the hospital instead of just checking the people over the border. Yeah.
Okay, now you spoke about Sam. Let's give you the chance now. Want you to tell us how can somebody come in contact with this identical virus? What are those symptoms? What are those signs that if the person feel like this is happening to me, probably it's about the monkeypox, I have to go to the clinic or hospital. Let us discuss it so that people who are following can get this understanding.
Thank you. This mpox is totally dangerous. Like, if I may say, dangerous more than maybe an HIV. Currently, like, if I meet with someone, then we play a sexy, either protected or unprotected.
Mhm.
You understand? This mpox will come over me, will attack me, either protected or not
Unprotected.
protected. Which means if someone during a sexual intercourse, we all sweat. You understand? We are enough mature. We sweat.
Yeah.
Understand? However much you may be wearing 100 plus condoms, you will be positive of this mpox. Which means there is no one to trust when it comes on sex intercourse. Therefore, if I meet someone with one skin rash during our sex intercourse, that skin rash will break, and those fluids from it will start flowing to the skins, the contact skins, which means within 1 day or two, according to our immunity system, me personal, I'll be developing another challenges that are totally foreign to my skin. So we are going to differentiate between signs and symptoms. Symptoms, those are the signs that we cannot see with our naked eye. But signs, those are some changes that come out on our usual skin. Like, first and foremost, the symptoms, there is a headache and a super fever, and also lymph node pain, joint pain. Those are the symptoms. But when it comes on sign, we develop something that we can visualize with our naked eyes, such as skin lashes. So, which means, and this mpox is totally dangerous when it comes on our private parts. That's why I call each and everyone to be aware of it, to pay attention with this mpox. It doesn't joke when it comes on our private parts. Sometimes we as youth, new generation, our current generation, we have this kind of mentality of shyness, like the people I used to receive during my testing, PCR testing. I used to receive people who were suffering from mpox. Then by making a conversation, but then you ask, why didn't you come in early stage to the hospital? You know what they say? I was shy, things like that. Shy, scaring to explain whoever sees me. But now imagine you are coming while your walking style changed completely. Then you ask the person, does anybody from your entire family know the situation that you are facing? He says no. Then you ask why? Because you're supposed to be escorted by someone. Why? shy. That is the response. Shy. This our shyness are going to kill us. So imagine Mpox when it comes on private parts, like automatically pens, it can be cut off. You understand? We are enough mature, good enough. We have some scientist students. So we are talking about something that each and everyone knows. So when it comes on private parts, the pens should be cut off and pick it from the ground. So there is no comparison between Ebola. There is no comparison between COVID-19. No way. Something that removes your private part. It is totally dangerous. So if I mention the private part of a male, imagine a female how it should be.
Yeah.
So which means there is no one to trust. When you have your own partner, make sure that there is no snitching. Yeah, thank you.
Yeah, CEO.
Yeah, go ahead, Victor.
Yeah, let me come in quickly. So, I want to know, in the case of Rwanda, as we know, the Mpox, the Marburg virus, the Corona, and that of the Ebola, they are under the biosafety level. I think it should be like level 4, the biosafety level 4, wherein currently we don't have a queue for it. Yeah, so it has been classified at level 4 of the biosafety level. So, those that came down with the monkeypox, and then we were told that there is no cure, no specific treatment. So how those people received treatment from the hospital? How did they really recover? What were some of the treatment given to them that led to their recovery?
Thank you, Victor. That is a good question for each and everyone. Like he said, there is no specific treatment for Mpox. We treat symptoms, you understand? Like we give out some paracetamol for the pain and also antiviral for that heals these viral infections, and also acyclovir for also for the pain. So far there is no specific treatment that it can eradicate completely this mpox, except just treating the sign and symptoms. Yeah.
Okay, Victor, you done. So before we can go to other panelists to ask questions, let's come up with a video from this guy.
Okay, good morning, good morning. Sorry, this is my face. I think you can see my face. This is it. I'm about to go to the hospital. I just came from the bathroom and I'm about to go to the hospital. Wow. Fuck.
So you can see how you're feeling pain. You saw the it's kind of a painful. Yeah. So Brooks, Brooks, let's hear you. You sat quietly and you've been listening to our guests. Let's hear your 2 questions.
Okay, thank you again for the opportunity. You guys are hearing me? Give me thumbs up if you are hearing me. Okay, that's good. Let me appreciate our guests and for that brilliant deliberation on the topic, especially on this disease. My concern has been June to the issue of this Mpox in the context of encountering and the avoidance. Yes, from Patrick, he said it is zootenic, and looking at it, it's a let's say communicable disease, airborne disease as well. So living a household as family, and then with the context of Liberia, because he might not speak about Liberia, but with the case of Rwanda, if we can use Rwanda case, and then we'll be able to get information from him that can be communicated back home, our people can follow some of those, how you can contact it and how you can avoid it. You said in the context of sexual activity or maybe contact with another person, when an affected person has it and you come in contact with that person, automatically you will encounter that sickness. So in Rwanda here, what are some of those measures that were put in place? Because we can remember years or months ago, I mean, let's say years ago, Rwanda experienced the same, and now it's no longer, though we now get much data about it. So what are some of those avoidance measures that were put in place? And this was like, I mean,
Thank
treated.
you.
Though it was Vitok said it doesn't have a treatment, but in another sense, medically, you guys can prescribe certain way or treatment that can be combated. So what are some of those measures you got put in place here, or that it was worked
Very
on?
good question.
Can you speak to us on that too?
Some preventive measures that each and every single country should put into implementation. Number one, of course, you have to understand that those preventive measures are supposed to, protect ourselves. Number one, it is a personal hygiene. Personal hygiene, not a group, not in a group. It is an individual concern. You have to make sure that you wash your hands, you understand, in order to protect yourself and the other individuals. You have to make sure that your personal hygiene, it is the paramount. Okay. And also when it comes on this practice of sexual whatever, you have to make sure that at least you and your partner, you trust one another. There is no one snitching each another. So the personal hygiene is the most needed in us. There is no another thing. You stop sharing your clothes. Stop kissing each other. That you are not trusting each other. Like someone you did not spend the whole day together, you can't trust. There is no hug. Like you spend the whole month in Rwanda and you meet someone in Liberia, you need to hug to show that kind of, welcoming love. So there is no trustable movement. No kiss, no hug, no clothing sharing. Even if you are still single, not married, you need to sleep alone.
Okay.
I may say,
Let me come in with another quick question. I mean, maybe you can respond to it, or Seton respond to it as well. Looking at it, that this is a virus that can be contacted also from animals. I mean, back home, some people, I'm probably here, you guys don't eat bush meat, but in our country, like bro, eat bush meat. And for Seton, what are some of those specific animals in the bush that you think we can communicate with our people to start avoiding them from eating them? That
I think
based
each
on
and
you
every,
guys study,
yeah,
counter that from them.
All
each
right.
and every
Thank you,
single
Chief.
African. Okay.
Yeah, thank you, Chief. Yeah, there are
So
many animals actually.
Seton, can you set up good and talk to us? Set up. You relax like you start making money the day you start making money being in your office. Set up good and talk
I,
to us. Go ahead.
yeah, thank you. So there are so many animals that we advise people out there should eat till Liberian be declared monkeypox free. We have rabbits, monkeys, like we say rats, but then we call them opassion in Liberia. We want our people back there to stop eating those kind of animals. And then one advice I would give to our brothers and sisters out there, we get people going to marketplaces, the real light every day. Everybody want to be selling and other things. But one advice I would give there is that you have to wear on long sleeves. You see someone that going ups and down every day because this virus actually transmitted through sweat fastly. Like it's very fast when it's transmitting through or sweat. Thank you.
Thank you, Seton. Let's go to Ami. Ami, you've been sitting quietly, following the conversation. Uh, what do you have to say about the conversation? And then your question to Patrick. You have two questions to ask. Go ahead.
Okay, thank you once again. So, our guest, he has just said everything. So, for the mpox, which is commonly called the monkeypox virus, it's primarily spread through direct contact, as I've learned, with an infected animal's human or contaminated material, like he said. So, things to suspect when you have encountered this virus is fever, some symptoms like fever, headache, he said it already, muscle aches, fatigue, edema on your lymph nodes, like some swelling on your neck, kind of, and then sore rashes on the face, and also will spread to other parts of the body, as we saw in the video of one of our brother from Liberia. So, to prevent this, or the preventive method for this virus is number one, I have avoid direct contact, because if you have it so infected, maybe through bodily fluids like sweat, saliva, what of you can get in contact with this virus. So you need to stay away from an infected person, and also personal hygiene, like he said. One thing, personal hygiene is very important in this, in particular your hands. 99% of, so your personal hygiene, you have to wash your hands frequently with soap and water, and then you use hand sanitizer for the preventive measure. So for people who are at higher risk for developing this virus, they need immunization. When I say immunization, like vaccination, they need vaccination. And then for the treatment, this virus is not the same. When I say the same, like there is no specific treatment for this virus. Like there is no specific treatment for it. But supportive care can help manage symptoms, like I said earlier, hand hygiene, and you avoid direct contact. It can help. So some of those medication, like he said earlier, like pain relief, you can also use pain relief to stop the symptoms, like acetaminophen, which is commonly called paracetamol. And then always consult a healthcare professional before taking any medication. So in conclusion, so when in controlling the spread of this monkeypox virus, if you suspect any exposure or experience any symptoms, you experience any symptoms, you seek medical attention, or you reach out to the nearby hospital for further investigation because it is very serious. It is very, very much serious. And for some of our brothers and sisters who always like to, like maybe they like clubbing or they love to win this football game, they should stay away from those activities because you're gonna get in contact with this virus. You don't know who is beside you from those bodily fluid like sweat. You're gonna get in contact with this virus. So that's what I have to say. And my first question to Mr. Patrick. So you said that this virus is like airborne disease. So I want to know, is it really an airborne disease or is just classified as an airborne disease?
You are muted, Patrick. We are not getting you. You are muted.
I was saying that she mentioned about an airborne disease. We cannot classify it completely into an airborne disease. No. But when it comes to how someone is being contaminated, is being affected, like someone who lives with someone who is in serious with it, but by talking, you spread those, droplets salivary, and it goes towards you. That's how you can be affected with it. So that's how I can even say that it is an airborne disease sometimes, but there is no specific ways of saying that it is an airborne disease. But according to my own experience, the way I live, I see how people, trying to speak together, spreading the salivary droplets, and reaches affords you. That's how I can say that it is somehow an airborne disease.
Okay, thank you very much. And
Yeah,
my second question is not really a question. So, as I've learned, this disease, the source of this disease is like direct contact. Is it a direct contact, like because you mentioned something about sexual intercourse or sexual activity, right? Okay, so this virus is like a direct. So the source of this virus is it direct? Yeah, actually,
no, I'm not getting.
I'm
Can you?
asking if it is through direct contact the virus. Okay, thank you very much.
Okay,
No,
you got the questions?
That's get
no,
something.
no.
That's get something right. That's get something right. I mean, are you asking him if it is a direct contact virus or what? Just make it clear that he respond to it.
Yeah.
Both.
Oh, okay. Mr. Patrick, he's saying that. I mean, she's saying that the virus is a direct contact virus. Maybe you can get it directly from another person. That's the question she's asking. Maybe you can
Yes,
respond
of
to it.
course. Why not? That's why I said that. That's why I mentioned but about sexual intercourse, hugging. I mentioned hugging. I mentioned kissing. I mentioned sharing the clothes. I mentioned sex intercourse. That is a direct contact. It is.
Okay, so the source of this virus is like direct contact, right? That's what I want to know. Okay,
Another
thank
thing,
you.
another thing you would like to ask is how comes to be, you know, direct contact while the people use the condom. That is, does it make sense?
Yeah, sure. So can you please explain to me?
By interpretation,
Hello.
In the beginning, I said that this mpox can affect you, can attack you during during protected intercourse. I mean, protected sex intercourse or unprotected intercourse. But now let us talk about protected sexual intercourse. As long as you use 100 times of condoms, you understand, you get affected.
Yeah.
If you meet someone with a single skin lash, which is not even in public skin, but remember, during when you sleep together, you squeeze each another. By squeezing each another, that skin lash breaks, and remember that skin lash holds fluids. Those fluids starts flow to your skin, to your both skin. Because of your weak or strong immunity, you shall develop some skin change within 1 day or 2 days, according to your immunity system, how strong it is to you.
Okay.
That is how you can be affected, either you are using a protective sex intercourse or not. Thank you.
Okay, okay. Thank you, sir, for clarity. I mean, the source of this infection is animal. It's not direct contact. The way in which it's transmitted is through direct contact.
Okay.
Thank you.
Mamay, do you have a question to ask Patrick? So, folks, if you are watching, if you want to make your point or ask question, you can call the number on the screen +2310790802109 and make your input. You know about the conversation tonight. We are in conversation with Patrick. Patrick, what is this? Is your last name is what? Patrick. Patrick, who? Your last name?
It's Mugabo.
Okay, we are in conversation with Patrick Mugabo. He is a lab scientist from Rwanda here. He's also giving his own expertise when it comes to the monkeypox virus in Liberia, how they handle it in Rwanda, and explaining some of the preventive measures that people can take, what to watch out for. So if you want to ask question or you want to make a point, you can just call the number on the screen. If you are following through Facebook or YouTube, you can make your point tonight. Thank you. Back to Mamay. Mamay, do you have a question? Second round. Two questions. Let's go around.
Yeah, so I will give two into one questions to our guest tonight. They are all lab technicians. So before a virus can be classified, I want to believe that there can be some level of testing to know that, oh, this other virus is corona, this other virus is Ebola, this other virus is Mpox, this other virus is Marburg. So in the testing labs, is there any mechanism that distinguish the lab results from the test results coming from either Ebola or coming from corona, to distinguish monkeypox from, what can be the what can serve as the yardstick in determine the difference between either this other virus is Marburg virus or it is a Mpox? Because sometimes some of these things our people don't believe it. Some will say, oh yes, I will drink my Ghana, or these are just white man sickness. Yeah, some people don't really believe, because some will tell you that our old people been eating bush meat. They didn't, during those days, they didn't experience anything like monkeypox. They ate their bush meat. They were healthy. Their children live on bush meat. Now, white people telling us that we shouldn't eat it when they themselves have invented those sicknesses to kill or to reduce the human population. Now they're telling us monkey that we have been eating, or passion that we've been eating, rats that we've been eating. Now they're telling us not to eat it, and we need to survive. So is there a specific mechanism put in place to test and know the differences between these viruses in the lab?
Yeah, of course we use different reagents. What do you study for now? Are you
I
currently
studied
studying?
environmental science. Environmental
Oh,
sciences.
I would have said that you need to be invited in my laboratory. Then I will show you how they are totally different according to different relatives. That we work on. So we use different materials. Mpox has its own different materials that we use until the end product. COVID-19 also, Rift Valley the same, uh, hemorrhagic fever the same. So uh, I would like to invite you, then I show you how each and every single virus looks like. But remember, all of them, they are DNA. Those who study, biomedical knows DNA and the RNA. So for you, it will be very hard to understand the difference between DNA and the RNA. So I would like just say, and by the way, I would like to mention something that whoever goes to the hospital, make sure that you search for something relating to your sickness, so that whenever whoever meets with a doctor, you may be understanding at least, the treatment gonna be given to you. Yeah.
Yeah,
So we have.
the reason I asked the question,
Mm.
yes, the reason I asked that question is that these are some of the things our people still don't want to believe when they say, oh, there's an outbreak of this other virus, the outbreak of this other virus. Because when you talk about Ebola, they will tell you rashes. When you talk about COVID, they tell you rashes on the skin. When you talk about Mpox again, they tell you rashes. When you talk about the Marburg virus, they tell you that fever, that rashes. So it's somehow complicated. So that is why I wanted to know, because if I'm a patient, I go to the hospital, I have rashes. So you have to text to say maybe the other rash or the other rashes are not, or corona. These other rashes are not Ebola. These other rashes, I don't really know. So that's why I decided to ask that question. So thank you.
Yeah, you're
Yeah,
welcome.
yeah. To come in, chief. Well, one thing I will tell you is that that's why you see before any entity or organization comes over test for any sickness or diseases, you first do a testing of that virus or the disease. When they test the virus or the disease, after testing is when they are going to come in again and tell us that this reagent is used to do a test for this. And every virus or diseases have their own samples to be collected. There are some virus and diseases you use plasma, serum, and other things. For now, if we start demonstrating it here, there are other people in this session will not understand what we are saying. So that's why it's telling you that you should come to the laboratory. I understand your question very well, but then every virus or disease comes with their own tests and reagents. So if they think that all of the viruses we are talking about have the same signs and symptoms, you have to get to the hospital to know this sign and symptoms, which virus is causing these signs and symptoms on them. That's why we are talking here. Thank you, bro.
Thank you, Mr. Trygo, for that contribution. Each and every single disease has its own sample. Like COVID, we used to sample from the throat or nose. But now when it comes on monkeypox, we break those skin lashes. You understand? And they fetch those fluids. You see the difference? Okay, thank you. But during also Rift Valley, this is a virus that attacks cows. You understand? We used to collect the blood.
Frederick, can you mute yourself, please? Frederick, mute yourself. Frederick, mute yourself. We are getting feedback from you.
So you understand, bro? Hemorrhagic fever. Yeah. Have you ever had the hemorrhagic fever?
What is that?
This is a disease also recently took over in Rwanda that killed most healthcare providers in Rwanda.
Hmm.
Yeah.
How does it look like? What are the symptoms?
The symptom the same as Ebola, and it kills instantly.
Hmm.
There's no need of transporting you to the hospital. Just whoever meets someone with this hemorrhagic fever, super suspected. So in that virus also we collect blood. COVID-19 we used to sample from the throat or nose. Mpox, totally different from them. Mpox will break those skin lashes and correct those fluids in that skin lash, or sometimes salivary. You see the difference?
Okay. Okay, so thank you. As we go along, let me try to recognize some of our followers, those who following by social media. Want to say thanks, Prince A.S. Williams for watching. He say, but I'm following. That's good, Prince. Thanks for following. We have Joseph T. Kaba. Joseph say I'm following live from Foya, Lofa County. Thank Joseph for following us this evening. We have David Flomo. He said, great show. Thanks for the program. Thanks, Joe. David, for following. We got B. Jerry and Sile. He's following from Cyprus. Thanks, Jerry. And we got Elijah Donner. Thanks for watching. And so the list is continuing. A lot of people still following. I want to say thank you so much for joining us this evening. This is what we do here at Screen Vision. And today we are discussing the issue about monkeypox in Liberia. While I think listen to our guests, he talked about what is monkeypox, what are those symptoms you should watch out for. So I'll come back to you, Patrick. Let's look at what are those preventive measures that a community can put in place. Let's take it from the individual level. Let's look at the entire community. What are some of the things they need to do to avoid the spread of this virus?
The smallest I think each and everyone should practice in is just personal hygiene. Personal hygiene holds each and every single protective measures, preventive measures. Washing your hands daily, either you're coming from the toilet, public toilets. Because whenever you go to the public toilet, you come over, then you touch on your faces, where your skin. So that's where personal hygiene concerns you. Stop sharing our clothes.
Okay.
Understand? And also preventive is the most secure than going to the hospital. So whoever practice these preventive measures, including personal hygiene, washing your hands properly, using soap or sanitizer, you are wonderful. You are wonderful. Even you can clap for yourself, for sure. Simplest preventive measure.
Okay. So let us look at what are some of the lessons that Liberia can learn from Rwanda when it comes to the outbreak response mechanism. What are the lessons that you think we can learn from Rwanda?
Pardon?
What are the lessons you think that Liberia we can learn from Rwanda when it comes to outbreak mechanism?
Oh, very good question. This question is the most challenging one because it is a lesson that one country should fetch from another. And so one thing that Liberia should learn from Rwanda is to invest in the hospital healthy sector. So whenever you invest in the healthy sector, those are the people who are there to fight against those viruses and different diseases by bringing out there some personal protective equipment. So if in the hospital there are no equipment, our entire community is the problem, starting from the hospital to the whole community. So remember, there is something we call nosocomial infection. Those are the infection that we fetch from the hospital during our admission. So if in the hospital there are no some equipment, which means our clients, our patients, is going to fetch something new and carry it to the family. So we need some good governance that invest in health sectors completely. This will eradicate each and every single disease. Sometimes our governments, African governments most especially, they ignore to take care of these preventive. Sometimes they receive even some donation and they put them in their wallets, which is not wrong. You are killing your people. So a good governance should subsidize where subsidization needs to be. If it is to build an infrastructure, let it be. If it supports the health sector, if it's supposed to support education system, let it be. Don't put it into your wallet. Don't serve your family, relatives. The subsidies you've given is for the community, not for your own purpose. This goes upon with the government. The good government leads and watch the community and protect it.
Okay, so we want you to elaborate more on that. We're not still concerning the government. Let's look at on the health side. We listen to you talk about you need to invest more in health, in the health facility, which of course is key. But I guess there are some measures you got put in place when you got the case that yes, we have a one suspected case in Rwanda, and those activities, those things that you guys did to prevent the spread of that stuff. That's why we want you to explain what can we learn from that.
I think you give us the picture shows the suspect cases, which is, and the active case, which is a 35, and also you gave out suspected case, which was making 700, and also the lab tested cases were 60, 18, yes, like that. Now you can see this active case 35. You can even remove it. These active cases should be isolated until they're gonna be healed completely. Then you go back to the community. If anyone is being suspected with this Mpox, any single virus, should be isolated in the hospital, because the hospital holds isolation rooms where those people should be put in, and the care provider just keep taking care of them. If we have these 35 cases active, they should not go back in the community. If we will allow them to go back in the community, we are going to kill the entire community. We are going to kill the entire country members. So the hospital must build the isolation rooms where the cohorting people should be. If I'm suffering from monkeypox, I should go in the room where my members are lying, not mixing the patients. So if we have those isolation rooms we are protecting our entire community, our country members. Yeah, that's what should be put into implementation in whichever country.
Okay. So let's come back to Ami. Ami, do you have another question for Patrick, or you got something to add? We're about to close now. We are wrapping up.
It is almost time, even.
Yeah.
Okay, so thank you very much once again. I have one question to Mr. Patrick. So my question is that what advice will you give to someone who has been diagnosed with this virus, monkeypox virus?
What?
What advice will you give to someone who have been diagnosed with this virus now out there, who have already been diagnosed?
Sometimes we lose a hope. If someone is suffering from that virus, he loses a hope, she loses a hope. Being in isolation room, it's like putting you in a prison. But remember, as the advice I should be giving to someone who is suffering from monkeypox in isolation room, what you should put in your mind is that you are in the room where the doctors and nurses and even those lab scientists are taking care of you, are watching you. Remember, there is no one should bring you a food. The government feeds you. There is no, you need to do not lose the hope because you are being taken care of. So if you are there feeling alone, it's not the prison. It is the kind of taking care of yourself. Don't lose a hope. Within 2 weeks, you are going back home. Because if we treat someone in the community, he will keep moving, affecting other people. That's why those isolation rooms are being set to put someone who is suffering from different disease like that one specifically, to stop spreading that virus.
Okay.
Yeah.
So that means we should, encourage the persons, those nurses, that you are not alone. There are other people who here with you, encouraging the person, so that because once the person start to feel somehow, even that alone is another sickness, right? You start to feel the trauma, being isolated from a family, all of those things. So it is good that you said that we should encourage them that they are not alone. So, Comrade Brooks, we are trying to wrap up. Let get. Do you have another question or question for Patrick? Brooks, is that a network issue? Oh my God. Okay. So, Mr. Patrick, we want to say thank you so much. We appreciate you for coming.
Hello.
Yeah, I'm coming. Seton. We appreciate you for coming. Yeah, we do appreciate. So before I come there, Seton, we're about to wrap up, right? We're about to wrap up. And we'll come back to you. We want to appreciate you for coming, Patrick, to share your ideas, to us when it comes to this virus in Liberia and other part of the world. So we appreciate that so much, and this is why we do here at Screen Vision. We usually discuss issue that is affecting the world. Interesting topic. We usually discuss it every Sunday. Yeah, we discuss that, and we have a special show called Environmental Talk on the Wednesday where we discuss only environmental issue. So we want to appreciate you for coming. I think we learned a lot from you tonight, and we hope that you will still come back here because we will have some health discussion as well, and we're not going to do so that you can come back to share with us. So is there anything your parting comment, the last thing maybe you left out that you want to tell us before you can leave?
Another thing I would like to allow each and everyone to note is that remember, you have to love yourself more than anyone should come out and say that I love you. Your life is yours, not for your parents, not for your family relative. It is yours. So whenever you treat yourself poorly, you are going to, you are going to torture the entire community, including your siblings, Yet our siblings are just believe in ourselves. So when it comes to these viral or outbreaks, we need to be aware of it, aware of them. Protect yourself maximally by your personal hygiene to put into practice. Another thing I would like also to add on is to call upon the governments, because the most richest institution we have in this world, it is our government. So whenever our government plays poor role when it comes to these outbreaks, the entire is falling down. So we call upon our entire government to come and watch us, to come and see what is happening in our entire community, not just being there and be seated in their offices and keep watching what is happening without making a solution, because they are the one who holding the solution of this community. So it is my pleasure to be a part of this contributive discussion. And next time I wish I'll be here when it comes on economics. I'm an expert. I can develop some. When it comes on politics, I can just try to share, but not penetrate in it. And also, I can be good of it. Thank you so much.
Thank you so much, Patrick. Do have a share. Good night. Thank you. Seton, we want to appreciate you as well, Seton Trygo, for connecting us with Patrick. Today Patrick is here. I think he has shared a lot of information with us. We want to appreciate you so much for your effort so far. Now we're about to leave you. What your founders say? Your parting comment.
All right, thank you, sir. And I would like to tell Patrick, thank you very much. And also Screen Fusion Administration, thank you for bringing us here. But there are a few things that I wanted to at least make some statement on. Like one, we talk about, like you has discussed, asking Patrick on what are measures to accommodate put in place. I will advise back there in Liberia for our people there to at least forget things like social gatherings. Seriously, we are still taking this to be like a joke, but monkeypox is not like virus to take for a joke. And another thing we have to do is like isolation, like you said, isolation of the 35 active members. We should isolate them before it gets to another level, and then you see people coming in about quarantine. And I would like to advise and then recommend to the Liberal government to invest in health sectors. To invest in health sector. I know someone might be hearing us and they will share it to them to invest in health sectors, at least to help us when it comes to health related things like activities or health, so we can combat diseases and viruses easily and faster. Thank you again to Screen Vision. Thank you to Amy. Thank you to everyone for taking part, and I appreciate you all very, very much. Thank you.
Thank you, Trygo. We appreciate you as well for the connection you connected with Patrick, with Amy. Amy is such a brilliant, female. I listened to her analysis, presentation. I was like, wow, that's good. We have somebody in the house, a female. Unfortunately for us, we had another female patient, but she went off. She sent me a message that the network was not okay with her, and even Sylvester Blessing JJ2 were on the line. But the network too, kind of you're giving a problem. So that's why they both of them left. So even Frederick trying to join, but whenever Frederick comes on, the feedback we're getting from him and that the light is kind of a pull. So we couldn't, but we hope that next time Frederick will come back again to discuss social issues. And by the way, Amy, we appreciate you a lot for coming. Having you on the show tonight, it was like a blessing for us, because there are a lot of people been asking, but you're just on the show. We can see female coming on. We have a female, but they are kind of a busy, so most often they don't really appear on our show, you know. So we also trying to develop another program called Health Talk, or whatever nomenclature we're going to give it, but it's going to be a health discussion, health related discussion. So we will appreciate you if you got interest in coming on here every Sunday or whatever day they will select. So form part of Screen Vision team, and so that we can practice, we can preach while we practice. You know, it's important while you are practicing and you're also giving back to your community, because tomorrow it will be in your CV. Like, yes, I was part of entity called Screen Vision, and then we had this show that every day we used to provide, every Wednesday, every Tuesday, every Thursday, we used to provide some, information to the public. We used to carry on some awareness, educate the public, which of course it counts a lot. So I want to appreciate you. Now we're about to leave you. What's your parting comment and your overall, comment on the discussion tonight?
Okay, thank you very much, Mr. CEO, for your organization. Of course, actually, it's my first time to be up here today, and I'm very, very grateful and appreciative, and all thanks to my friend and brother Seton for inviting me tonight on this great occasion. So it's a pleasure. I mean, yeah, we are all doing this for the betterment of our country and whatever we are doing. So, okay, my overall information today or tonight to the public is that they should they should stay keen to what we have said and what our guests have said already. Like, this virus is a very, very much serious issue, which of course it is an international, or it has reached an international concern. So they should take everything into consideration. And for those who are listening or those who are watching this live program tonight, okay, please don't be selfish. Please share this to other people, because some of our brothers and sisters who are currently suffering now or today because of the virus, or who have been diagnosed with this virus, uh, some of them maybe it was the lack of education or information from other people who happens to know the information. So tonight, as we gather here to give this great information out there to the public, if you are watching, please, you can share to other people, because there are people who are waiting to hear, like, they want to know, okay, like, I know the cause of this disease. I know how the disease can occur, but they don't know how to prevent themselves. So, like, what all we have said here tonight, the preventive measure, you take and put into practice the personal. So thank you to you, thank you to Seton, thank you to every one of us who are devoted our time tonight to be here to give this great information out there for the betterment of our country and our people. Thank you very much.
Thank you, Amy, and you have yourself a very good night. Okay, so that's how we would like to take a leave of you here on Screen Vision. My name is Titus V. Ballah and the band Trygo. Trygo, thank you for joining us. We see you when we see you. And thank you so much. So, folks, we have been discussing a lot here tonight, and we want to say thanks to the folks for joining us from the INES-Ruhengeri University. These students are doing biomedical laboratory science. You listen to Amy. Amy is from Awoka, another university at the Rwandan University of Central Africa. I think Central Africa, yeah. So she's also doing general nursing there, and so you listen to her. I mean, listen to her discussion. Why she put out, it means that she's on top of the information, right? So that's why we tell you every time, let her come here to discuss the issue. Let's bring people. If you are in your field, what do you think the public need to know from your field? You have to contact us, and then we give you the platform to discuss it. So we want to appreciate everyone. Look at this guy. Look at Jabate. I think this guy is actually doing.
Okay, good morning, good morning. Sorry, this is my face. I think you can see my face.
It's kind of painful. You can see your face. But like I said from the onset of the discussion, I also want to appreciate him for coming up to tell the public that, look, I have this identical virus. This is how I got this virus. And today he's all on the internet. There are a lot of people listening to Patrick. They won't do that. They're afraid, they're ashamed, so that people can, bully them. But for this guy, he came on, to share the experience, what he going through when it comes to the virus. So we appreciate him a lot. And we all should do the same. If you are in your community, you see somebody having such a symptom, try to reach out to the clinic or to the hospital, nearby health center, to seek a treatment. Because like Patrick said, your health is your wealth. It's all that you have. If you die tomorrow, you won't go with your son, you won't go with your daughter. You're going to leave them back. So the way you take care of yourself, like this one time, I've been feeling, uncomfortable. I was like, I'm not well. So I went to the hospital. I went to do a checkup, and the guy did, I think, 7 different tests. And one of the tests I saw on the something, it was like HIV. I was like, what? So when they did all the tests, I was kind of worried, what is going on? But when he came back, he was like, you are okay. Nothing is doing you. Yeah, okay. We checked. He doesn't have HIV. He doesn't have immune infection, this, that, this. You are okay. So what you need to do, you just need to relax yourself, drink enough water. So don't allow maybe you get sick to the extent to a certain level that you cannot move, and then somebody start carrying you around. It's good that if you are feeling uncomfortable and then you have means to go to the clinic, visit the clinic, visit the hospital. Like I've been kind of thinking, I'm not feeling good in my body. And we went with the whole lot of tests. And I was okay. They were telling me nothing. I was like, wow. He said, yes, you're okay. So at least I'm cool now in my mind. So you can do the same. There are a lot of things that are killing people these days. And it is because you are hiding it from your very self, because I'm not saying in public. If you are not well, try to reach out. Share some of these things with people who you trust, so that they can advise you and guide you in the process. So on this note, we want to say thank you so much for joining us every time, most especially our followers who always follow when we're discussing such an issue. We want to say thank you. And we say we're very sorry, because from back home, we tried to get on the radio, but you saw the guy came on, I think 2 different times or 3 different times trying to set up. But I mean, the network was not actually giving a chance. So meaning we were not on the radio back home. But we can assure you that the next time we try to play something good, and we get another radio station that are going to relay this program, the other radio station will take it from them. So we also want to appreciate the radio station back home for giving us, yes, you guys can go about doing it. We don't have a problem. Just that because of the network. And we have already contacted one radio station that these other radio stations will relay from. So we cannot be in the middle and we try to call the other people like, you have to come and the other people will relay. It's going to be like conflict. So that's why we just left it like that. But trust us, as time goes back, we're actually going to put our program on your radio station. That's why we need you. We need your effort. You have to contribute. How? Share the show. You don't have to give a physical cash. If you have, that's fine. Because like you saw the overlay we're doing here now, we use the paid version, every month we pay. So if you can contribute, that's fine. But also you can share our show. Encourage people. Like, follow, share, comment. Go on YouTube. Go on Facebook. Go on Instagram. Follow the show and share. That way, our show will go to 1,000 people. Let's assume that we're about 30 following. They just assume. And then every time we comes on, 30% share, 30% like. If 30% share it like, it are going to more than 30% because each individual have their own followers, right? So, they're going to go across the information, and which, of course, we're going to appreciate. So, thank you so much for joining us. My name is Titus V. Ballah, and I'm here with a team. I had a very good team here at Screen Vision where we discuss issues. You saw the likes of Brooks, Victor, Prince Williams, Sylvester JJ, Blessing JJ, all these people, they are doing their best, because to come on here to discuss issues is not easy. You have a busy schedule. You have to study. Like today, I have a serious online meeting. I have to leave that meeting and then come here to discuss the issue. So there are a lot of sacrifices we are making here. So thank you so much. I'm about to leave you. You have to say a very, very good night. Thank you. Bye-bye from my end.
With one vision, one nation, one dream, let's move forward, let's be seen. And here, let's unite. Because we rise, we shine, we keep it real. Breaking good news, you can't refuse. Stream vision, light the way, bringing truth to every day. Stream vision, light the way, bringing truth to every day. Stream vision, light the way, bringing truth to every day. Stream vision, light the way, bringing truth to every day.
Standing for progress and standing for peace. Justice to come for let rise on our feet. People inspired from what we can teach. Voices echoing why in the street. So I've been lost, let us go and retreat. Shining so bright like the star in the east. Follow script vision, let's move and be seen. We are the best, let the public confess. Brother records out there, there's no need to be stressed. The stronger, the bigger, the larger we get. United we think and accomplish the threat. Building the dream of the nation at large. Women empowerment to in our eyes. Education is the key.